practicing.
Pull your toes up. You want to keep them at 90 degrees, dorsiflexion, okay? Locked in at dorsiflexion, because if they're plantar flex, that's when the ankle is most unstable. To make it most stable, we put it into as much dorsiflexion as possible. If you were in the athletic training room, we have tape cookies that we put on either side just to prevent the tape from rubbing. So this is your pre-wrap. When you're doing your pre-wrap, you're actually practicing figure eights and heel locks at the same time. Keep that in mind once I start to show you. If you're an athlete, I'm going to stop taping right there. The reason why is I want to make sure we have skin to tape contact that reinforces the tape support. For today's purposes, I'm going to be nice to Pat, and we'll send it all the way up. When you start your two or three anchor strips at the top, it's not cranked down real hard to crimp it and cut off blood circulation. It's snug, okay? Okay, you guys are going to struggle tearing tape, okay? Don't get frustrated. Just practice tearing tape and it'll be easy. All right, so that's the two anchors, or 2 to 3 anchors up top. Going into your figure eights, you start on the inside, pull it around the base of the foot. There's the bottom part of your 8. Go around, there's the top part of your 8. Same thing, you do 2 or 3. I like to do 2 when I know the guy is not injured or the young lady is not injured. Now for your heel locks. Start on the inside, go back and around, start and stop where you begin. I'll do 2 of those on each side. You want to try to make the tape job nice and neat, because any type of wrinkles can create rubbing and friction and create a blister. Now I'm going to go to the outside, down and around, back and around, start and stop where I began. Do that again one more time. All right, those are called your heel locks. Your stirrups, 3 to 4 stirrups. You start medial to lateral. I like to rub the tape because friction helps the tape secure to the surface of the other tape. Medial to lateral, overlapping a little bit of each stirrup. When you overlap the stirrups, that helps reinforce the tape support itself. 3 to 4, depending on the person or the injury. Basically, the tape job is done now. Now I got to secure it so it doesn't unravel when you put your sock on. Start up top, start your close up. When you put the tape down, put it on a little bit of an angle, because if you put it on straight like this, it's going to crimp on you. Put a little bit of angle on it until it gets you down base right above the ankle joint. Once you get down here, then you want to start your horseshoes. Those help put the tape nice and snug around the Achilles without it rubbing. And anywhere between 3 to 5, all the way down to the base. Now I need to put my little heel or anchors on the very bottom. This is the ones that you do not crimp down real hard at all. You just lay it over the tape so it doesn't put a lot of pressure on the base of that 5th. If it's too tight on the 5th, when he steps up, his foot won't be able to splay, and that will create a lot of pain. So that is an ankle tape support. You ready? Let's have a quiz. Today we're going to go over as many, 4 of them if we can. We'll do the hip flexor and groin right now. Okay, so this is considered a double 6-inch ace wrap. Can you toss that to me? So we always put the heel off the ground. Okay, so hip flexion. Remember, hip flexion. I want to try to assist with the ace wrap. Okay, pull your shirt up just a tad bit right there. So the key is pulling it up and out. So hip flexion is up and out. So when I go around her, here's the motion, up and out. That's going to help her hip flexion motion if she has a hip flexor strain. Her foot is off the ground a little bit, toe is pointed in just a slight bit, up and out. That creates the support for the hip flexor. And basically you just continue to do that until you run out of ace wrap. In the athletic training room, we typically have stretchy tape that would add on to this just to help secure it in place, and then some white tape for today. when you're done, you just tuck it in. In a perfect world, I'd like it to stop up at the hip so it doesn't roll off. So, and then as she walks away, she can feel that assistance.
Pulls me up this way, because that's what we want to be doing, making it extra bounce up.
So that is the hip flexor. Again, the knee is bent, a little bit more internal rotation of the hip.
Because we want to add it to our pelvis, right? Add towards our body.
Resist that or enhance the adduction. So I'm going to start on the involved side. Hold that right there for me, please. Go around once, and the motion for this one is up and in. Okay? Again, coming down and around, securing that groin, up and in. You can go down to about the middle part of the quad, making sure that the hamstring and the ace wrap doesn't ball up, and then up and in. Pretty simple concept. Once the ace wrap is at its end, just tuck it in for today's lecture, and then you can just feel the resistance with that wrap. It's resisting that adduction, assisting adduction. Resist abduction, assist in adduction.